So I decided to do a video all about my teeth. Because as you've probably seen in my videos, that my teeth are crazy screwed up. And you don't even know the half of it. I guess I will just tell you the whole story. Don't you like my nails? They were like French tipped long nails, and I painted them black and then put like this glittery, sparkly coat over them, so they're like galactic nails. But anyway, I haven't showered in like a day, so my hair is like, it's all crazy. But anyway, I have always had bad teeth, even like as a kid. Like there's always been weird things that happened with my teeth, and I've always just had bad teeth in general. And like when I was a kid, I had, and I say kid, I mean like 6, like 5, 6, 7, 8, up until they fell out, which I don't remember when they fell out. But I had 4 capped teeth on the bottom that were silver caps. Like I had 4 completely silver teeth on each side. Or I had 2 on each side. And then I had fillings in all of the back ones, all of my top ones. The only ones that seemed to be okay were my front teeth. But yeah, all my back teeth, always, always had cavities. And I never really took care of my teeth. Like I brushed them when I remembered, or when my mom, sorry, there's like food from breakfast stuck in my teeth, or in my mouth. But anyway, I would brush them like when my parents like made me or whatever. And I always like avoided it because it would like make me gag. I wasn't comfortable like doing it, and I never had bad breath, which is weird. But I also always had mints. Like I always sucked on wintergreen mints or like minty gum, and I would pop mint after mint after mint, and it's one of my obsessive compulsive things that I do. And so I would have like 4 or 5 pieces of gum in my mouth at any time and stuff. So I always had good breath, even though I didn't brush my teeth. And the gum like helped keep them clean, but obviously not clean enough. But anyway, as I got older, we stopped going to the dentist because we moved, and I started having a lot more problems with anxiety. So going to the dentist was kind of like really hard for me to go because I would gag or, whatever. Around 2009, I think it was 2009, I ended up having to go to the dentist, and they told me I needed a root canal on this one. On this one. And I needed a veneer or a cap on that one. Ugh. So I did that. They tried to give me nitrous oxide. Horrible experience. I was laying in the chair and they cranked it up, and I wasn't feeling anything. Like I didn't feel loopy, I didn't feel relaxed, I didn't feel anything. And I had the little nose cuff thing, and I didn't feel comfortable at all. And I was laying in the chair, and they're like, "How are you feeling?" I'm like, "I don't feel any different." And they're like, "Okay." They turned it up as high as they could possibly go, and it had been like 45 minutes of me just breathing this gas, and it wasn't doing anything. And they were finally like, "Okay, well, it's been enough time. We're just going to go ahead and get started." So I was like freaking out, and I was like shaking so hard that the light above me was shaking, like that really bright light that they shine into your mouth. That was shaking. The table with all the tools was trembling, like everything on it was rattling. And they were like, "It's going to be okay. Just try to relax, just breathe, blah, blah, blah." So they leaned me back in the chair, and they started getting to work. And they had to fill in like a few cavities first. And they did those really quick. But then the root canal on the front tooth, it's just one, like it's one root. It just is one. So it's easy to do. But they have to hollow it out. If you've never had a root canal, they're horrible. They hollow out the root of your tooth. They end up like filling it with this like cement type stuff, and if you taste it, it's horrible. It tastes disgusting. And then they drill and carve it out. This one, after they did the root canal, they had to shave down my tooth. So under this is only like that much tooth of my natural tooth. And then in the back, up near the top, it's there. But it's cut, like my whole tooth is like cut in half. So they gave me a temporary cap for that. Well, anyway, so we're in the chair and he's working on me. And all of a sudden I start shaking. Like the shakes kind of went away for most of the treatment. But I think what happened was they gave me way too much nitrous oxide. Like they pumped me full of nitrous oxide. And then I think when I started to get anxious, I started to feel sick from so much of the drug. I started breathing through my mouth. So then the nitrous oxide started to wear off, but it didn't wear off like, you know, they say like only after 5 minutes of breathing, you know, straight oxygen, all the nitrous is gone. Well, that didn't happen with me. I had like a really bad reaction to it. And so they were like, and I started to like close my mouth and cough, and they were like, we're almost done, we're almost done, we're almost done. Just stay calm, stay calm, stay calm. They didn't want me to puke, obviously. So they like finished up as quickly as they possibly could. They snapped the little cap thing on my tooth, and they just used like a super glue kind of thing to put it on there until I got it was like a temporary, and then I got the veneer, like porcelain later. But I, like, as soon as they said, okay, we're good, and they pulled the tools out of my mouth, I sat straight up and had to like pinch myself and like grab my earlobes, and even talking about it, I had to like try not to throw up. See, it makes me like nauseous and anxious talking about it. But so yeah, that happened. I think I had 13 cavities that they had to fill, and I think they did like 5 or 6 the first time, and then I had to get the rest, like the 6 or 7 the next time I went when I get to the root canal. Because it also had a really bad cavity. That's right. It had a cavity, needed a root canal, and needed a cap. So anyway, I sat straight up in the chair, and I started sweating, and I turned white. My dentist freaked out. And when I say he freaked out, he turned white. Like, he was nervous before even starting work on me, and he probably shouldn't have started work on me, but he was like, we got to get it done. And he wasn't really that sensitive to, like, anxiety and all that crap, so he, like, pulled everything out of my mouth and, like, left the room. And my mom said that when he walked out of the room, he looked so scared and so worried and just, like uncomfortable. And she told me that later on, and I was like, what? You know, they're trained professionals, you know, all that stuff. So anyway, so for a couple years, I had like perfect, gorgeous, straight, white teeth that were beautiful. I love them. They were perfect because I had always had this one was crooked. It's like it's like tilted. So it's crooked. It points like this, like my tooth, or like this. Like the back is behind this one, and then it sticks out further. So I'd always have, like, my sister called me snaggletooth, which I have a snaggletooth now, but that's what she called me. And when I got them fixed, it wasn't noticeable at all. Like, they looked perfectly straight. So for a couple years, I had perfect teeth. When I moved out to Oklahoma, I didn't have a dentist, and that was in 2012. It was like right as it turned 2012. I moved to Oklahoma because of a bad situation, abusive relationship, being stalked, and all that stuff, and having my new boyfriend threatened, and my family threatened. So I moved as far away as I possibly could for my health and for my family's safety and for my boyfriend's safety and just, you know, all that stuff. So when I moved out there, my teeth were okay. And then after about like 4 or 5 months, no, I had a small cavity that I saw for a while, but it was like really small. It was just like this little tiny You couldn't even notice it. And I only noticed it because, you know, I looked at my teeth a lot. And it was like right in between the two where they connected. And I was just like, it's just a tiny little cavity. I can take care of it whenever. Well, I got pregnant. And when I got pregnant, that's when everything just went. So 2012, like around May and June, I got pregnant. My tooth chipped somewhere between like June, July, or August. It chipped. And then I was like, okay, I gotta get this fixed. But I was pregnant, I was nauseous, my anxiety was like through the roof because I was just worried about everything. I was trying to plan a wedding because we were planning on getting married we got married in October. And so I was like planning a wedding. I had family that was like scrutinizing us for getting pregnant before we were married, for being in this situation, for living with my parents, my husband not having a job. It was just really stressful. Really like crazy, and it was my idea to come back here in the first place because I didn't want to be alone. I didn't know if my husband wanted to be with me. He was my boyfriend at the time. I didn't know if he wanted to get married. I didn't know if he wanted to have a kid. I didn't want to make him do anything. I didn't want to be alone. So we came home. Anyway, so my wedding came around. I still had the broken tooth. It wasn't that noticeable in the pictures. Like, it was noticeable, but it wasn't like really, really bad. Not like it is now. It was a little discolored, but my pictures, you know, you can't even see it. So that went on. And then I had my baby, Ash. I had him. It chipped more, like, right before I had him. And then after I had him, it chipped again. So this is kind of like the current. It keeps kind of, like, seeming like it's getting bigger and bigger. So that's kind of what's happened. But I got diagnosed with hyperthyroidism. And I think I've had this my entire life. Because going over the symptoms of it, this is stuff that's been going on since I was a child. Like, I was a kid. So I visited like a bunch of dentists. And I went to one, and he told me that he wanted $40,000 to cap and root canal all of my teeth. All of them, and take out my 3 wisdom teeth, because I only have 3. I don't have one on this side. So $40,000. Right. And that's for like anesthesia and like all that stuff. But obviously can't afford that. So we kept waiting, and it chipped more. And all this time, like all like the pregnancy and all that time, my teeth slowly started breaking. Like, all of them started breaking. I have one all the way in the back that's half of a tooth. It just broke off one day. I was like, oh, I got a pretzel stuck. And I went like this, and the whole back part of my tooth fell off. Just fell off. So there's that. And then all of these on the bottom, you can kind of see it. They're all broken away from the gum. They've all chipped away from the gum. I can stick my finger under any of them near the gum line. My bottom teeth are obviously crooked, but they all have cavities in the very tops of them. They're starting to go down into the center part of my tooth. My enamel is like completely gone, and that's been since I was like 18. My enamel's been like gone. But yet my front tooth now has a big hole up near the gum. It's got all this. It's like black. It's completely rot. These are all broken on the bottoms. They all have holes. This one has a big crack in it, as you can see. And then they're all just kind of coming away from the gums. He told me that I do have gum disease or periodontal disease, but he said it was mild. It wasn't like, severe. So he was like, just, use mouthwash and stuff. But I can't use mouthwash because the pain is so excruciating. It makes me gag, and then it hurts for like 6 or 7 hours afterwards, and it's excruciating. And I would just rather, I can't do it. So that's that. And I recently went to a dentist, and he told me that my best option is to have all my teeth removed and get dentures. The only problem with that is I'm a gagger. I am a gagger. Like, I gag just, like, with my anxiety levels, it makes me gag. And then just kind of sometimes food texture makes me gag. Or, like, sucking on lollipops sometimes makes me gag. And having something that goes up all the way up here, comes across, and goes across the roof of your mouth and tucks, and then there's ones that go, the bottoms that go, next to your tongue and where you feel them, that would make me vomit. I know for a fact that I would not be able to wear them no matter how well they fit, no matter how short they trimmed them. It wouldn't work for me. So I'm trying to find, and this is my current situation. This is the past week. I am trying to find a dentist that will do sedation. I wish they would do general anesthesia, but it's really hard to find somebody that is affordable that will do that. So I'm trying to find a dentist that will do general anesthesia, implants, where they put the metal rods into your jawbone and then you can snap on your denture, but it doesn't go all the way up and it doesn't go across the roof of your mouth, and it's a lot more comfortable than wearing dentures. And they're also stable, so they don't wiggle, and if you talk, they're not going to pop out at you, which is also really gross and uncomfortable. So I'm trying to find that, and I've found a company called Affordable Dentures, and I've been looking them up on the internet, and I've been watching tons of denture videos of Callan Jacks. If you have problems with your teeth and you're considering dentures, watch Callan Jack's video. It's Kalinjax. She is awesome. She had dentures when she's young. I'm only 23. She had them pretty young. She in her 20s. I think she says she has kids. I can't remember. I have brain memory problems. But anyway, she's awesome, and I watched all of her videos. The only thing is, I can't find anybody that has, a problem with gagging, that they, can say, oh, yeah, I had a really bad problem with gagging, and then it got better, so I don't know. And some people are like, oh, it never goes away, and I never got over it, and then, all this stuff. So I've been watching her videos, and then there's a ton of other people that just do videos about getting the extractions and then getting dentures and getting realigns, and people who are like, oh my god, they changed my life, they're the best thing that I've ever done in my entire life. And I'm like, okay. So I'm just trying to get myself into that mind frame where I'm going to be I'm going to be okay. This happens to other people. My life isn't, I'm going to cry. My life isn't over, And it's getting worse because I'm getting more self-conscious. And especially doing YouTube, it's kind of I feel like that's the only thing people are going to focus on. They're going to be like, ooh, girl, what is wrong with your teeth? And sometimes I do wear a ninja's mask. It's a cosplay mask, and it kind of looks like a medical mask, but it's a solid black and it looks kind of like a ninja thing. Actually, it kind of looks like RAIDEN's mask from Mortal Kombat. That's kind of what it looks like, but it's black. And I sometimes wear that, and then most of the time when I talk, I cover my mouth, and especially if I laugh or smile really big, because there's the hole up at the top, and then this one's all broken and discolored, and I'm like, oh my god, yeah. So if people come up to me in public and I'm like, oh, I'm like, oh, how are you doing? Blah blah blah. I cover my mouth, and it's just really embarrassing. It's really, really embarrassing. And at first, I wasn't that embarrassed when it was just a little chip and it was just a little gap. I wasn't that embarrassed. I was like, I need to get it fixed, but now it's my husband likes good teeth, and I don't have good teeth anymore. When we met, they were perfect, and now they're not perfect. So, but he loves me no matter what. He just wants the best thing for me. He thinks I'm going to regret getting all my teeth taken out, but there's really no other option that we can afford. I can't cap them all. I can't save them, because with the thyroid thing, they're just going to keep deteriorating. So I talked to my psychiatrist, and she said that I should really hassle my insurance company and be like, this is a medical condition. My teeth are rotting out of my head, and I'm going to have heart disease because I have bad teeth and they abscess. They do. I have this one over here abscesses constantly. So, and it's got a huge hole. Oh my god, there's a huge gigantic hole that I can stick my tongue in. It's disgusting. I can get my whole tongue, the tip of my tongue in this hole. But anyway, she's like, you need to harass your insurance company and be like, this is a medical condition, this needs to be covered. Especially at least some of it needs to be covered. So I'm going to do that. She also suggested, which I thought was funny, but it's actually a good idea, going to Tijuana, Mexico to get surgery for my mouth, because their prices are like significantly, like 70% less in Mexico than they are here, which is like crazy, because she knows a lot of patients that go for that skin removal surgery after they have like a bypass and they have all the extra skin. They go for that. And she said it's so plush and it's so nice, and there's always that stigma about Mexico being dirty and all this stuff, but she said it's not like that at all. So I'm looking into places in Tijuana and Mexico and other places that do implants and extractions and sedation and blah, 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 blah. But in the U.S., I did find a place. It's $8,000 to get extractions, to get my implants, to get the denture piece, to get... it's not really sedation, it's halcyon pills. And then my doctor told me that if I did that, she would give me another sedative so that I would be totally relaxed. And I told her the dosage, and she was like, that's a pretty good dose of that medication. And then if I gave you this, you'd be totally fine. Because I'm afraid that if I have any consciousness of like them in my mouth, and don't you think being awake and having 31 teeth removed while you're awake is the most horrifying thing ever? Like, imagine hearing those nerve and like pieces of your tooth just snap, or hearing them pull them out, or slicing your gum and pulling them out. Like, that is just freaking horrifying to me. I am terrified. That freaks me out. I don't want to do it. And I also have a thing about my mouth being numb. I don't like anesthetics. Like, I can't use Oragel. It makes me... What? No, can't do it. Just gagged. But yeah, can't do it. So, yeah. But that's basically the story of my teeth. So anybody that wants to comment and be like, girl, you are fucked up and ugly, I know, it's okay. It's really not okay, and that really hurts my feelings, but I know it's gonna happen no matter what. But girl, you better know that when I get my teeth fixed and I got that perfect pearly white smile, I'm gonna be flashing it all over, and you are gonna look foolish because I'm gonna be fun as hell. Just kidding. I still have my big nose and my crazy eyebrows that don't grow in properly, and my short hair that I keep shaving. So, but no. So yeah, that is the whole story of my teeth, my current situation, and my past with my teeth and all that stuff. So if any of you have any tips, oh, baby's getting upset. If you guys have any tips or ideas, please let me know. That would be awesome. Subscribe to my channel if you haven't already. I'm going to be doing a lot of vlogging videos and a lot of like follow me arounds and beauty stuff. And I haven't been wearing makeup in like any of my videos except for like one. And I was wearing sunglasses, so. But I'm going to start doing them. It's just I'm having trouble with my computer, and I film on my phone, so I'm trying to get my cameras to work. I don't know. It's blah. But anyway, like this video if you liked it. Comment or whatever. Subscribe. It'd be awesome. So I want to get to know you guys, and thank you for watching my videos. Peace.